We listen to your feedback and we are implementing that. So let us know your thoughts in the comments below. Don't forget to like, subscribe, and share to your friends. That will help us continue our journey on listening to your letters and answering your questions around mental health.
And for those of you who may have joined us or come and seen us for the first time, the Therapy Ants is being created in the style of Agony Ants. And in this space, we tackle concepts, therapy, ideas, concepts, issues that we ask ourselves, or you may be asking yourself and have nowhere to address your questions. This is the place. We come in and tackle all things mental health, well-being, difficult subjects like grief was the first one that we tackled, grief during Christmas, in a safe space, in a space where no question is too simple or too silly. Ask, and we will try and answer your question for you, because if you've got a question, I can bet you 2-3 other people have a similar question. So no question is too small, no question is too silly. And if Zani or I can't be able to answer your question, we'll come back. We will go and do some research for you, come back, and together we will try and find something that suits you or fits your purpose. So that's how Therapy Ants came to be birthed. Zani and I are psychotherapists and hypnotherapists, really passionate about mental health and well-being and demystifying mental health. We really do want to make it as accessible as possible for everybody, because it needs to be.
So we've all been in contact with someone that may be suffering poor mental health, or we have suffered ourselves with poor mental health. Everybody has mental health, whether it's low, high, managed, not managed. We all have mental health. So it's important that we are kind to each other and kind to ourselves. How you can get in touch with the Therapy Ants is we have an email address, thetherapyants@gmail.com. Or if you want to contact us anonymously, we now have a Google Forms document, which will be pinned in our show notes and also on our Instagram, The Therapy Ants. You'll find it in the bio on there. So you can contact us, and we don't take your emails from that. It is just an anonymous form. So you can write any of your queries or concerns on there related to your own mental health, or how, it might be a question, how do I support my friend?
So in the spirit of demystifying, we have a question that came in, and for complete transparency, this came from my mother when I was studying to be a psychotherapist, and I started off doing psychology and then psychotherapy. She was like, okay, I'm confused. You are mine, but I'm confused. And her letter was, I am confused about the different titles people hold within the mental health field. How do I know who will best serve my needs? And I sat down for a moment and I thought, wow, this is classic, isn't it? We're so in the business that we tend to presume that the people that we're talking to know the difference between all these titles that we are carrying. So I said to Zani, we must address this one.
What is a psychotherapist? Because it's not a word that's often known in the counselling therapy world. Psychotherapist is a relatively new word that's being used more and more and more in the counselling world. And we have the issue where counselling and therapy isn't regulated in such a way that anybody can class themselves as a therapist or counsellor. You can do a 6-week course on talking therapy and you can set up private practice. Doesn't mean that you've got the affiliation though. So I would say the first thing to make sure of is to check out the Psychology Today, the counselling directories, to make sure that the person you choose is registered, because they usually can't be on those spaces without being registered or insured or qualified. So that, I would say, is the first thing to think about if you're looking for a counsellor.
So maybe we start off with identifying the different titles that you may have come across or you've had in the industry. So the ones that I know of, and the ones that I have different questions. And truth be told, even when I was training, that was one of the questions I had. I remember asking my tutor, what is the difference? How do I differentiate all these individuals in the trade? And so we have a psychiatrist, we have a psychologist, we have a psychotherapist, then we have mental health practitioner and a counselor. I think those might be the most common ones that you may have come across. There are subgroups in those. So if you come to a psychologist, then you have an assistant psychologist, etc., etc. But they will fall under the umbrella of a psychologist. So if we are just naming the head title, the headline titles, let's talk about those.
The difference is initially the training. So a counsellor will have obviously some kind of training qualification. Psychotherapists like Audrey and I, we studied for 4.5 years to get our foundation of our training done. And everybody in the field, the counsellors right the way up to the psychologists, will all have to do continued training. So where we pick up further studies along the way. But with psychotherapy, we have learned integratively, which means we can pull from various models of work and really target our work with what the client needs.
That's right. So in psychotherapy, you have been able to what we call holistically look at an individual. You are able to pull in elements of their childhood, elements of their everyday behavior. You can be able to let the client themselves, which is usually the foundation, drive the way the sessions are going to go. But the tools in your trade allow you to intuitively understand and be aware of what your client is presenting and be able to pick up a tool that will be able to fit the client in front of you, which is why it takes a long time. It takes a long time to be able to look at a situation, at an individual from all angles. We know how complicated the human being is. What I'm seeing this morning is not necessarily what I'm going to see this afternoon from the same individual. And that's what a psychotherapist is going to be able to understand, to gauge, to be able to interact with, and pull out the necessary information. The organization that looks at you and says, we know you, we know that you've done the appropriate level of training, and you are safe enough to be able to deliver and handle a client who presents with whatever issue that they're presenting with. And we are covered by those governing bodies. So you have the British Association for Counselling Professionals, you have the National Counselling Governing Body. So there is somebody who is looking over your practice and how you practice your trade, and you are accountable.
With psychotherapy, we're looking at long-term issues, repeated patterns, and the therapy is often long-term. The goal is to help the client to no longer need therapy, to give them all the tools they need to be able to leave therapy and know exactly more about themselves, be more self-aware, and not fall into the same patterns that's caused them issues in the past. We're looking at moving them forward with all the knowledge and to experience life in a new way.
So in brief, that is saying that the psychotherapy can be long term, and the counselor can be short term. And we say long term and short term, all those are relative, depending on the individual, because in every one of these situations, the client drives the period that they're in therapy. So what does that mean? It means when you come to therapy, the more open and trusting that you can be, the better your sessions go, the more fuller of an experience you have. I say this knowing very well that there is a trust that needs to be built, which is why it's all relative. Because when you meet your therapist, there you have to build this relationship. You need to be able to know, is this somebody I trust? Because we cannot get away from the fact that this is somebody that you're opening yourself up to, and we are aware that opening up presents risk. We are very aware of that, and we do not take it for granted. And so we are very appreciative and grateful for the trust that you are placing in us as therapists. And we do not take it for granted, and we do not hold it lightly. So that with that in mind, there is that level of once you start on your journey, once you've built what we call the rapport, the relationship, what you get out of it is what we're talking about short term and long term. So with a psychotherapist, it could be long term because of the depth of information that we're trying to pull out of you, because these are things that you may not even be aware of. A lot of that stuff is childhood. If you're, and it's buried for a reason. It is buried for a reason. It's been keeping you safe. So for it to be excavated and come to the forefront, for you to feel safe enough to talk about it, that requires time, which is what a psychotherapist would help you with. Whereas a counselor would be short term and more often than not behavioral. So it is, I'm struggling with this thing. I need to get over it because it is stopping me from getting from point A to point B. I'm going to go and see somebody who can give me some tips that can be able to get me over what my short-term objectives. And then it could be that whilst you're having that experience, you then uncover their more in-depth buried things. And then you think, and your counselor, if they're a good counselor, will then signpost you and say, I've reached the end of my capabilities. I need to refer you to somebody else. And all of us across the field, whether it's a psychiatrist, a psychologist, a psychotherapist, if we are worth our salt, we should be able to know what our limitations are and refer you on to somebody else, because our business is you and getting you the best support.
Refer you back to GP in order to give you the additional support that you need. And that is maybe when the GP would look at everything that you present with, and you would perhaps be then referred to a psychologist in order to assess, sometimes medicate. And when you finish with a psychologist, sometimes they would even advise to go back to psychotherapy in order to make sure that you've got some support outside of their support once they're ready for you. Sometimes we can work together with the GP and the psychologist in order to give you the best treatment for you. And it's all about you. Like Audrey said, it's client-led. It's we go at your pace and we notice things that need to be noticed, and we deal with them appropriately.
So now that we've talked about medicine, let's go back to the beginning then. So who then has the authority to medicate? So that becomes the role of the psychiatrist. So the psychiatrist has awareness of mental health and all the conditions attached to mental health, but they can also, most importantly, do two things that are different from any other of the teams. So they can prescribe medication, and the medication is an aid. It is not a cure. Okay. So you're coming to us, for example, us being a therapist for anxiety. You're not able to communicate effectively with your therapist. So your psychiatrist or your therapist would send you to a psychiatrist, to your GP or your psychiatrist, who's going to give you something that will help you in the short term, so that you're then able to utilize your therapy. It is not going to cure your anxiety. It is going to lower your threshold so that you are able to communicate more effectively with the person who is going to be able to help you deal with, manage, and give you the tools to cope with whatever it is that you are struggling with. The second part of that is diagnosis of some of the conditions that we are now seeing in everyday language. ADHD, for example, autism, for example,
Bipolar.
schizophrenia. What's the other one I'm missing? Bipolar. That's right, bipolar. So the psychiatrist is able to complete these assessments and be able to give you that diagnosis, because there's a series of tests that have to be completed. Okay? So what does that tell you? That tells you that for you to be given a diagnosis, and we use these terms very loosely in everyday language now, which can be very, very detrimental to our mental health. And maybe that's the take home here. You know, knowing this information, we can do better in how we describe ourselves. We're very fond of saying, my cat is bipolar. You know, some of us understand what that means because you're using the traits, the behaviors of somebody who presents as bipolar would be showing, but it is a specific diagnosis. It takes a series of assessments, very in-depth ones, to get that diagnosis, to get that title, for lack of a better word. And for it to be removed takes equally as long, because you have to go through the same series of assessments to show that you are no longer having those traits, which is why it becomes, that's one of the reasons why it is not that easy to get that diagnosis. For you to be identified autistic, ADHD, bipolar, we push a lot for terminology, for identification, which helps, and we understand, because if you know what it is, then you are more able to deal with the outcomes of those. Equally, the flip side of it is people behave differently when you've been identified with these. And for those titles to be taken down, it also means you have to go through the same process. And that's not an easy.
So we do get people that are in our rooms who are trying to come to terms with their potential diagnoses as well. And we can hold that space for them while they're being assessed, as long as they're in the right position and they're seeing the right people alongside us. Often there's a team of people that do these diagnoses, which is why it takes long. If you've got one person and maybe 5 people coming up with this diagnosis, to make sure it is correct and to make sure it's going to benefit them in the best way possible.
So the psychologists and the psychiatrists are the two people who are qualified to be able to come with these psychological assessments and diagnoses. So you can see how involved it is. And that depth of data should give you an indication of how important it is for them to land on the correct diagnosis for you, on the correct title for you. Because if you're misdiagnosed, that is something that you can carry for the rest of your life. Now you see why it is so vital to have that right person.
As people come in our rooms and they're wondering what the difference is, and people talking amongst themselves will wonder. I've worked somewhere where they've asked me what the difference is because even they're not sure. So it's a minefield. We will list in the show notes and write a little caption about each profession, so you've got something to go back to and look at for the times when you're confused.
Remember, psychiatrist is the person who deals with medication, which is a chemical imbalance. Or do I need to send you to a psychotherapist who has the talking therapy, who has the behavioral therapy, who has the ability to split the information into its different strands and threads so that they can identify exactly what kind of support the person needs? Or even better still, do I need to send them a counselor? Each individual has their specialism. Most people will see a GP first. The GP will then send them to different places. Now, this information to you gives you the key to your own autonomy. Knowing this, where do you want to go to? You can go now, stand in front of your GP and say, now that I know the difference between all these people, send me to this person.
Registered, qualified, insured.
Tick the box, put a spreadsheet in front of you, and this can be your checklist for when you're sitting down and thinking, okay, I need this, or my person needs this.
I am a qualified psychotherapist, which is doing slightly more than a counsellor. So like in my view, a counsellor is kind of like helping someone through the surface of their issues. Sometimes you might dive a bit deeper. There's some brilliant counsellors out there that can really help support someone through through mild anxiety, mild stresses, you know, someone that wants to talk through their grief response or anything like that. But often, like you say, the client knows what the issue is. They might even just want to sit and vent. They've got a space to relieve some of that stress, and it can be really, really important and a really lovely space to do that in. But in psychotherapy, we can dive deeper and work out, okay, why do you not manage your boundaries well? Why are you coming up with these patterns of this response? Is it a defense mechanism? Where does it come from? And all of that knowledge, just like today, knowledge holds power. All of that knowledge about yourself brings all this self-awareness. It snuffs out the shame. We speak about bringing shame to light so that it's not hidden anymore. And it takes away its power. So you bring all that into the room and you explore it. You suddenly you see it in clients, they shift and they suddenly make this conscious decision to, oh, I don't want that to happen anymore, and notice it in their everyday life. And then they hold their boundaries strong and they they see the patterns happening and they say, oh no, this isn't good. I know what this red flag is now. I'm not going to accept it. I'm going to move away from this. And you really see that shift, don't you? And it has that effect where suddenly they're like, oh, I've got it. And it's really amazing. It's so rewarding to work in that space.
It's that light bulb moment, and and you're right, it's the pattern. So as a summary of what Zania has just said, so the counselor, which is why she's explained it brilliant about short term, is the immediate relief from whatever it is that you're struggling with at that point. you are looking for something that will help you move from point A to point B quite quickly. That's why it's called short term. The counselor will be able to look at your behavior or your surrounding in the short term for you to get what we call a quick win. Difference between the psychotherapist, the psyche is about the mind, the brain, the internal environment, is that these are patterns. And what's a pattern? A pattern is something that you've done over and over and over for a sustained period of time to the point where it's become automatic. And with it being automatic, you don't even realize it's happening. Which is why it takes a long time and it can be very frustrating when the penny drops, when you realize, oh my God, so this is my pattern. You're like, oh, what? And that's where there comes the work, the sustained return to your psychotherapist chair or office, because every time you talk about it, their job is to try and connect the dots for you. And then you discover one day you'll be like, it's that thing again, isn't it? Yep. That's the one. Oh my goodness, I didn't realize I'm always doing this. Yes. Then you register, I do this when this happens, and then I behave like this. And once you know that, you're like, now what do I want to do about it? It is a journey, but it is such a rewarding journey. And I don't say that because I'm a psychotherapist. I'm saying that as somebody who has been through the psychotherapy and continue to go through the psychotherapy journey. It is so rewarding when you find out what makes you tick, because you all of a sudden it's like it's a hack. It's a hack. You're like, I'm not surprised. I do something. I'm like, yeah, Audrey, you knew that was going to happen. You knew this. You knew this. You call yourself to a meeting and say, so what happened? Yeah, I just forgot. Today I'm human. And I'm like, yeah. Okay, let's do better.
That's brilliant. Always learning. That's what our supervision is for. That's what our continued learning is for, and the short courses that we do to keep us in touch and in tune with the world, and the new psychology theories that come out. We're always learning about ourselves, about each other, and about the clients that are stepping in our room.
Absolutely. It is a continuous journey. Let's summarize it. So what's the take home today? So what have we learned? So we've learned that there are different individuals who will deal with different aspects of your mental health and well-being. At the top is the psychiatrist. And we said that psychiatrist is the person who is going to be able to medicate, and they're also going to be able to give you a diagnosis like autism. Following the psychiatrist, we have the psychologist who can also diagnose, but they cannot medicate. That's a very key distinction. So they're able to complete these assessments, which we have discussed can be very intensive. They are not a one questionnaire kind of thing. They're looking at the individual in totality. They're going to look at your childhood, and they're going to look at the childhood from the individual's perspective. They're going to look at the person's social aspects. So whether it's going to be their GP, it's going to be their teachers, it's going to be their parents or their caregiver. So it is not a one-time assessment. They are really diving, a deep dive into the individual's history. By the time you get that diagnosis, it's I suppose the equivalent of an MRI. It's not just an X-ray. It's not an X-ray. It's an MRI. I think in medical terms, that's the best way I can give you an analogy. An X-ray will be at top level. An MRI We're looking at your bones. We're looking at your veins. It's a deep dive. I hope that clarifies that distinction slightly better. So that's a psychiatrist, that's a psychologist. And then we come to a psychotherapist. They can deal with your current patterns, your behaviors, your thoughts, your feelings, and they can look at you in a holistic picture, the whole total person, and respond at that moment intuitively long term. Okay, so it's a sustained piece of work for a period of time, and they can be able to pull all these strings together that the psychologist will have assessed. So it is possible that the psychologist will refer to the psychotherapist, the psychiatrist will have referred to the psychotherapist because of the wholesomeness of what the psychotherapist can be able to look at. Broad pictures. Start from, if you take a funnel, the funnel that you use to distill a liquid or something, the psychotherapist will start from the top and will be able to work with you to drill down in your patterns and behaviors to find the root cause, to find where it started. And it's a journey. It's going to be a journey, which is why it is long term. Okay? And then we come to the counselor who can work with you short term, and that is a quick gain. So it could be a behavior that is obstructing you for a short period of time, which is why you have things like CBT, cognitive behavior therapy. It's looking at your behavior and what is leading you to behave in a certain way. Doesn't minimize the importance of the work, because that quick fix is what you need to move to the next level. Okay, I hope that is making sense.
Side note that there's various other types of therapy. We've got speech therapy, cognitive therapy that you've touched upon, and lots of different things that go alongside all of these. A lot of these people are trained in those areas as well. And some counselling or counsellors with additional training will offer open-ended therapy, which is long-term therapy where people are showing up and just having that space to vent as and when they need it. And that is quite common in grief. For grief counsellors, it can often be longer term than just a few sessions. So it's important to note that as well, because we've spoken a lot about, we've just gone with the generics today, I think, but that's just to give you an overhaul of what it is to help ease some of that confusion. But hopefully we've done that. So don't forget to subscribe, comment, leave your thoughts, share with friends. And we can continue our Therapy Aunts podcast. The more followers we get, the more subscribers we get, the more interactions we get, the more we will be able to continue this journey with you by our sides. You can contact us through the email address, thetherapyaunts@gmail.com. You can fill in the anonymous Google forms, which will be pinned to both Instagram and our YouTube channel. So we have been editing this afternoon. We are a week after recording, I believe, 2 weeks after recording. And we've been editing and we've come across with some problems. We've lost the intro and the outro.
Outro, yeah.
So here we are, showing up. Just to say that there is no introduction today, but I have been Zanny.
And I've been Audrey.
And we have been the Therapy Aunts. And we'll see you next time.
Absolutely. See you.